Hi everyone! Today I'm here to talk to you about our innovation that can help your life better. Have you ever spent a long time waiting for treatment at hospital? Or have you ever been not sure about treatment at hospital? TELEMEDI-PHARM can help you. But what is TELEMEDI-PHARM? Let's go to know it. First, we are going to know two persons that are very important. They are our advisor. First, Dr. Thida Sothiyotin, and next, Mr. Panawat Muthirat. We have got a lot of group members: Tony, Japan, Namun, Theme, Playing, Sun, Cream, Shampoo, Fa, and Putri.
Let's start introduction first. From the videos ชุมชนสาธิตวลัยลักษณ์พัฒนา we have seen different costs of the community, whether it is social cost, knowledge cost, or wisdom cost. The most expensive cost that we have seen is health cost. Health promoting hospital or HPH are considered significant health costs because health promoting hospital is a primary healthcare service system that people in the community can easily access the public. Health Promoting Hospital is an organization that supports the people in the community. As we have seen from a video, we will see that ชุมชนสาธิตวลัยลักษณ์พัฒนา Health Promoting Hospital has small size, cause the problem of insufficient healthcare workers. Mostly treatment of patients is treated by nurses, so there is a chance that healthcare service may not cover the requirement of people in the community. As a result, some people in the community necessarily receive healthcare service in the hospital instead.
For all reasons, it causes congestion in the hospital and incurs a waiting time and indirect cost in the journey of some healthcare users who unnecessarily meet the doctor at the hospitals. From all these problems, our group invented the innovation TELEMEDI-PHARM, which is for telemedicine and telepharmacies, to elevate the health promoting hospitals to work more systematically and can provide services more efficiently, to reduce congestion in the district hospital, and to save the patient time in case of unnecessary go to the hospital.
And next, for the objective of our project, 1. To alleviate the burden of initial scanning of patients and reduce congestion in the hospital. 2. To reduce wasted time and indirect costs in the journey of some healthcare users who are unnecessary to meet the doctor at the hospital. And 3. To develop more systematically and efficiently work in health promoting hospital.
So we're gonna compare the original health service system in health promoting hospital between our TELEMEDI-PHARM. So let's talk about original health service system in health promoting hospital first. As you can see here, is an overview of the original health service system in health promoting hospital. Patients come to receive service at the health service system in health promoting hospital and then start the examination room or service screening by a nurse, which after this step can be divided into two ways. The first way is when patient got general illness, non-fatal accidents, and they will come to checking rights and registering the inspection. After that, get a cue card, then history taking or vital signs measurements. Next, meet with medical inspectors or perform basic procedures. On the other hand, if patient got serious illness, emergency, serious injury, and doubtful illness, they will refer to the hospital for treatment. And in the last, the patient goes home.
New health service system in health promoting hospital with innovations TELEMEDI-PHARM. This is overall flowchart about the new health service system after the TELEMEDI-PHARM has entered. The first process, patients comes to receive health service at the health promoting hospital. Next, patient screening by nurse depending on the nurse is divided into two parts. The first part, if the patient had a mild illness or general illness, the nurse can treat the patient. The second part, original patients with serious illness or chronic illness or doubtful illness that the nurse doesn't sure about the symptom of patients. The nurse will send the patients to the TELEMEDI-PHARM room. The doctor and pharmacist talk to the patients directly. Next, The doctor will talk to the patients via video call with AMED telehealth and line, then make a preliminary assessment of the illness. The nurse will support when the doctor needs patients' information such as body temperature and blood pressure, which will also record on the AMED telehealth the doctor is using. After the doctor talks to the patient, it's divided into two ways. The first way, step 1. After the doctor diagnoses symptoms that it's unnecessary to see the doctor at the hospital, the doctor will prescribe medication for the patient to take at home. Step 2. Pharmacist reviews doctor's prescription. Step 3. The approval prescription by doctor and pharmacist. Step 4. The nurse provides medicine to the patients according to the approval prescription. Step 5. The pharmacist explains the medication to the patients. And step 6. The patients take the medicine home. The patient's medicine is received directly from the doctor and pharmacist, which will increase the efficiency of treatment and make the work better, because the doctor and pharmacist are available to give advice and help the nurse without having to dispense all medications to the patient alone.
And the second phase, after the doctor diagnoses that patient has severe symptoms, treatment requires the availability of equipment and technology, medical procedures that must be treated by the doctor only, and then the doctor appoints the patient to receive treatment at the hospital. Eventually, the patient was treated thoroughly at the hospital to solve the problem that patients must go to the hospital without necessity.
This is the model of TELEMEDI-PHARM room. We have a video to show you what this room looks like. So let's watch the video now.
From the video, we can get an overview of the schematics as follows. With the TELEMEDI-PHARM room is divided into 3 subzones.
Let's start at Zone 1. Zone 1, TELEMEDI-PHARM zone. It has a computer. We use Acer Aspire C22. Camera resolution is integrated 1.0 megapixel HD webcam. Speaker, we use Creative PaperPad 2.1 speaker. CPU, Internet. We use the Village Broadband Internet Project on Net Pracharat. Application, we use AMED Telehealth and Line.
What is AMED Telehealth? On the part of doctor, the function of AMED Telehealth is command to treatment patient remotely and save progress note, issue medicals, prescription, and we will use Line OA to work together. Line OA to visit patient via video call. Line OA two-way communication such as video call and chat message. And on the part of the patient, log in AMED Telehealth for the first time and confirm OTP over SMS, TP confirm, daily report via Line OA, press the button to report vital sign, temperature values, oxygen saturation daily. At Zone 1, TELEMEDI-PHARM zone, there have shelves to put a mercury thermometer and pressure gauge, hospital toilet, 2 chairs and rubbish bin.
Zone 2 really like Zone 1. In this zone, we have beverage area, have many categories of book to choose from, have educational toy for toddlers, for pediatric patients, have air conditioner. Zone 3 really like Zone 2. This zone is for sitting and resting your eyes, have green scenery to help your eye relax, have soft sofa for relaxing.
Laws of TELEMEDI-PHARM. Before you use telemedicine and telepharmacy in the hospital, you should understand the law and follow the ministry announcement, including first, notification of the Ministry of Public Health regarding hospital service standard using the telemedicine service system 2564. The next is notification of the Medical Council of Thailand number 54/2563 guidelines for the practice of telemedicine and online clinics. and notification of the Pharmacy Council of Thailand number 56/2563, regulation of the telepharmacy service standard and procedure.
For the expected benefit of our project, 1. To reduce congestion in the hospital and lighten the loads of initial scanning of patients. 2. To reduce wasted time and indirect costs in the journey of some healthcare users who are unnecessary to meet the doctor at the hospital. And 3. The health promoting hospital can work more systematically and efficiently and solve the problem of insufficient healthcare workers.
For conclusion, the innovation TELEMEDI-PHARM, which is both telemedicine and telepharmacy, to elevate the health promoting hospital to work more systematically and can provide service more efficiently to reduce congestion in the district hospital and to save the patient time in case of unnecessary go to the hospital. Our innovation TELEMEDI-PHARM has got 3 limitations. First one is budget of health promoting hospital. Second is internet system. And the last one is uninterruptible power supply. This is our innovation called TELEMEDI-PHARM. You can see that it can make your life better. We hope this will be a small point in future to develop innovation. Thank you for attention. Bye-bye.